Oh, hi, welcome back. I have a very interesting case today of a very ill patient. This is a young female that has cerebral palsy since birth, and she is taken care of at home. And in the past few weeks, her caretaker said she was having trouble swallowing. She was eventually choking on food, and she had trouble chewing the food and properly swallowing, even choke on liquids. So she had dinner, had the same problem to swallow the food, and she went to sleep, and the next morning she just wouldn't wake up. So the family got really worried and took her to the emergency room. The doctors on the emergency room readily ordered a bunch of CT scans and lab tests, and we are going to look here at the images of the chest CT scan, which show major pulmonary disease, a pattern of acute pneumonia that is very common in such patients. So let's look at the images. This is it. This is a CT scan of the chest, a cross-section image modality. These are axial images, transverse images of the chest. So if it's your first video here, let's just do a quick recap. The patient is laying down on the scanner table. He goes head first into the scanner. His chest is facing upwards towards the ceiling, so his face is upwards. He is laying on his back. You have to picture yourself as if you were sitting by the sole of his feet, looking forward in a way that we see this is front, anterior, this is posterior or back, this side is left, and this side is right. Let me just scroll a bit down so that you can actually notice. These are breast. So these are breast, so it's anterior, and this is the spine, so this is posterior, this is left, and this is right, okay? So a chest CT scan is a scan that goes from the base of the neck to the upper portion of the superior abdomen. So this is it. We usually read a chest scan using 3 window configurations: a soft tissue window, a lung parenchyma window, and a different window to see if we can notice bone lesions. So we have bone, soft tissue, and lung parenchyma window. So this is a acute pneumonia in a patient that can't swallow properly. So we have to look for signs of bronchoaspiration, which means a patient tried to swallow food or liquid, and instead of that food going to the esophagus, the patient aspirated the food and it got inside the airways, the trachea and the bronchus. So this causes obstruction of the airways and contamination by multiple types of bacteria, and it leads to a major, very severe pneumonia, most commonly as a lower right lobe pneumonia. So, as you can see in this case, the right lower lobe is completely devastated by pneumonia, but we also have pneumonia on the other sides of the lung. We also have pneumonia on the superior lobe and in the middle lobe also. So this is middle lobe, and it has consolidations as well. The normal lung parenchyma is like this. This is consolidation. This is inflammatory substitution of the air spaces of the lung. So this is consolidation, this is acute pneumonia. And I can readily see, and I will show you, there is food residue right here. There is food residue right here occupying the airways. Let's just compare to the left side airway so that you can see. So this is a normal airway. It's black as air, so it's airway. And on the other side, we are supposed to see airway just like this, but we can't see it because it is filled by anomalous content. It is filled by residue from the broncho aspiration. So we have a proper diagnosis of a major, very severe pneumonia due to bronchoaspiration in a severely ill patient that has trouble swallowing. Let's just look for other signs of complications. So we are looking for a pleural effusion. Is there a pleural effusion? No pleural effusion, so no pleural collection. But we have to the other side, on the lower left lobe, we already have some small consolidations. The upper left lobe isn't clearly affected. We also can see that they already have installed a esophagus tube for feeding to protect the airways, because this patient is going to be staying on the ICU for a long time to treat this major pneumonia right here. So we have, right here, this is trachea, and we have, this is food residue. This is food residue. This shouldn't be here. This is obliterating. This is filling almost completely the airways and causing this massive pneumonia to the right and a bit to the left. So this is it. If you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click and keep watching. Thank you so much for watching, and I'll see you in the next video. Take care.